Video 24, Addressing Barriers to Implementation Area 2 CHES Sub-Competencies 2.5.1. Review the learning objectives for this video. Now let us talk about something that every health educator faces in the real world, and that is barriers to getting your programs off the ground. I want to prepare you for this because anticipating and addressing barriers during the planning phase is what separates programs that succeed from those that struggle. Barriers generally fall into four major categories, and knowing these will help you both on the exam and in your professional work. Logistical barriers are practical obstacles that prevent people from participating. These include lack of transportation to program sites, inconvenient scheduling that conflicts with work or family obligations, lack of childcare for participants with young children, and physical inaccessibility of program locations for people with disabilities. Cultural barriers arise from differences in language, health beliefs, cultural practices, and historical experiences. Language differences can prevent effective communication. Cultural health beliefs may conflict with program messages. Stigma around certain health topics like mental health or sexually transmitted infections can discourage participation, and historical mistrust of institutions, particularly among marginalized communities, can undermine engagement. Financial barriers affect both the program and the participants. Programs may face funding shortages that limit staffing, materials, or outreach. Participants may face costs related to transportation, time off work, or supplies needed for program activities. Structural barriers are systemic issues embedded in policies, organizations, and infrastructure. These might include lack of organizational capacity to support the program, restrictive policies that limit program scope, or inadequate infrastructure such as lack of internet access in rural areas. On the Master Certified Health Education Specialist exam, you need to be able to identify which category a specific barrier belongs to and recommend appropriate strategies for addressing it. Understanding these categories gives you a framework for tackling any challenge that comes your way. Identifying barriers is important, but here is where your skills as a health educator really shine, and that is in developing effective solutions. Let me walk you through 5 common barriers and their corresponding evidence-based solutions so you can see how creative problem solving works in practice. When transportation is a barrier, consider bringing the program to the community through mobile health units, hosting sessions at community sites like churches or schools, or offering virtual program options that participants can access from home. When language is a barrier, provide bilingual educational materials, hire bilingual staff or trained interpreters, and ensure that translated materials are not just linguistically accurate but also culturally appropriate. A direct translation often misses cultural nuances, so this step really matters. When scheduling conflicts with work hours, offer evening and weekend sessions, provide multiple session times, or create self-paced learning options that participants can complete on their own schedule. When community distrust is a barrier, partner with trusted community organizations and leaders who already have established relationships with the priority population. Use community health workers or promotores de salud who come from and are trusted by the community. When funding is limited, actively pursue grants from government agencies and foundations, seek in-kind donations of materials and space, leverage volunteer support, and explore partnerships with organizations that can share costs. On the exam, you may be presented with a scenario describing specific barriers and asked to select the most appropriate strategy. Always choose the solution that directly addresses the root cause of the barrier rather than a generic or surface level fix. You are developing the problem solving mindset that makes a real difference in communities. I want to spend a little extra time on structural barriers because they are often the most challenging to overcome and the most frequently overlooked in program planning. But understanding them will give you a real advantage. Structural barriers are embedded in the systems, policies, and institutions that shape the environment in which health education programs operate. Advocating for policy changes is a powerful strategy for addressing structural barriers. If a school policy does not allow health education during school hours, the health educator can advocate for policy revision. This connects directly to the advocacy competencies covered in Area 5. Building organizational capacity means strengthening the ability of organizations to support and sustain health education programs. This might involve training staff, developing new systems and processes, or forming partnerships with other organizations that bring complementary resources. Leveraging technology can help overcome infrastructure gaps, particularly in rural or underserved communities. Telehealth, online learning platforms, mobile applications, and social media can extend program reach when physical infrastructure is limited. Engaging leadership at the organizational and community level is critical for securing the institutional support needed to address structural barriers. Leaders can allocate resources, change policies, and champion programs in ways that remove systemic obstacles. And finally, systematically documenting barriers and the strategies used to address them creates a valuable resource for future planning. When barriers are recorded and analyzed, patterns emerge that can inform more effective program design. On the exam, structural barrier questions often appear at the Master Certified Health Education Specialist level because they require systems level thinking and the ability to connect planning with advocacy and organizational change. You are building exactly that kind of big picture thinking, and it is going to serve you so well as you advance in this field. Read the scenario stem aloud. Give students 30 seconds to consider options before advancing. The correct answer is C. Option C addresses all three identified barriers: scheduling by offering evening sessions, transportation by choosing a location accessible by public transit, and language and cultural comfort by using bilingual community health workers. Effective planning addresses multiple barriers simultaneously rather than focusing on only one or expecting participants to overcome barriers on their own. Summarize the